Yeah.
Yeah.
All right. Well, on behalf of the Rural Health Association of Utah, welcome back to the RHAU Rural Resource Webinar Series. We are excited to kick off the 2026 series with this April session. Our monthly webinars are designed to highlight practical tools and programs that healthcare professionals across Utah may not be familiar with the goal of strengthening rural health outcomes through greater utilization and connectivity. You can access the recordings and materials from this session as well as any of our past and future sessions at our website, www.rhau.org/RHAU-webinar-series. We're continuously building a comprehensive and on-demand library tailored to the needs of rural healthcare in Utah. Thank you for joining us today. Your participation is what makes these sessions meaningful. I'm especially excited for today's session as we're going to hear from three colleagues that have been longtime supporters of RHAU and have been engaged with our work for several years. Really excited to highlight what they do today. For today's agenda, the session will go as follows. We'll begin by hearing from Brown and Bonnie Fecowicz from Nightingale College. They're going to share how their innovative approach to nursing education is transforming the rural healthcare landscape. Following Bonnie and Kyle, we will hear from Stacey Peterson from Utah CTSI at the University of Utah, who will present on the Rural Connections to Research Initiative, which is actively expanding access to clinical research participation across rural Utah. Each presentation will be followed by a 5-minute Q&A session. Oh, sorry. I'm pleased to introduce Bonnie Fecowicz, Vice President of Nightingale Solutions. Bonnie leads the Nursing Executive and Workforce Solutions at Nightingale, partnering with healthcare leaders nationwide to address critical workforce challenges through innovative retention strategies and educational pipelines. Joining Bonnie will be Kyle Brown. Hold on, sorry, just closed out the wrong screen. Kyle Brown, who's the Regional Account Manager for Nightingale Solutions. Kyle is an experienced relationship manager specializing in nurse workforce development, and he focuses on strengthening healthcare teams through upskilling and nurse sponsorship programs with a strong commitment to keeping nurses in rural communities to help improve outcomes. Kyle and Bonnie, the time's yours. We'll go until 12:25.
Perfect.
Awesome.
Thank you.
Thanks. Appreciate that, Casey. Great introduction. We're really excited to be here today to share a little bit more about Nightingale College. And so Bonnie and I will be joint presenting. And so, I would invite her to jump in anytime if there's an idea that pops into her head that she can add to. So like Casey said, that's us in a nutshell. So you can go ahead and go to the next slide, Casey, and we'll introduce our whole team. So excuse me, and pardon me, I have a bit of a cold right now, so my voice kind of comes in and out, but should be okay. So we're part of a 6-member team here at the Solutions Division. Nightingale is headquartered in Salt Lake City, and we're a blended program virtual nursing school. And so the didactic portion of the education is done online, and then the clinical portions are done at the local hospitals and clinics out there. And on our team, we have Bonnie. She leads the team. She's the vice president. Me, David Bradshaw there, and Russell Gerard are the account and partnership managers. And Andrew is our director of solutions. He handles all the data and the information, management for our group. Go ahead to the next one. And you'll see lots of words today. So I just want to put your mind at ease. I'm not going to read all these slides and bore you to death. So I did want to show some statistics and some of the things that are challenges for Utah and the things that we're trying to focus on to make both the health outcomes and the nursing access better. And so Utah ranks 49th in the nation in nurses per 1,000 residents. So we have a ways to go to get up to this. The average is 9, and some of the best states were around 15, 16. So we're looking to, provide more education opportunities to try to help increase that number. And our number is only 7 out of 1,000. So we're behind the 8 ball there. And in Utah, 1 in 5 nurses is approaching retirement right now. So we've got to figure out how to build from within, right? Because we're not going to hire our way out of that situation. There's over 3,000 open nursing roles right now today across the state. And they're facing a 20% nursing shortage versus 8 in the metro areas. So it really is hitting those rural communities hard. 24 of Utah's 29 counties, as you know, are rural. So the big, the big geographic portion of our state is rural. And yes, 75% of the population is in the metropolitan areas. And we found, as we go across the country, we see this a lot in rural areas, but it's particularly true in Utah, where nurses recruited from outside the state don't tend to stay. They're here and then they leave. And whether that's because of the winters or the nursing pay, where they can get, what they can get elsewhere might be higher than it is in Utah. So whatever the case may be, we've got to figure out how to retain nurses, whether they're homegrown or whether they come in, right? And, the contract labor through travel nurses has been a gigantic hit to the financial situation with all the hospitals and clinics. So next slide.
So I'm going to jump in here. So thanks, Kyle. Bonnie, I've been an RN for 49 years. So I have a little street cred behind me on this one. I live in New Hampshire, but travel out to Salt Lake quite a bit, as well as all of Utah. I know the pain of living in a rural community. I live in a rural community. Nobody moves to our area for the nightlife when our major stores all close at 5 p.m. and our restaurants close at 7:30 p.m. So I was a chief nursing officer for many years, and I knew how to do that. But this school was approached to me through a friend and said, we're thinking a little differently. And I almost had the thought of, I dare you. And I wasn't really happy with higher ed all the time, because I felt what they were producing weren't nurses that could really easily work for me. So I had to spend a long time educating them. So this school is different. There was a predecessor of ours with a very similar name that was a bad apple. They were also Nightingale. I don't think they were called college, but sometimes we get mixed up with it. But this college has a blended format of learning. We're headquartered in Salt Lake. We are not brick and mortar. We want to be more agile, where in all 50 states, we're almost at 10,000 nursing students. We are just a nursing school. And Utah is home for us. And I feel very passionate that we have to protect home first. And if you want to call me Mama Bear, I feel that way about Utah. We're fully accredited regionally and nationally. And this NWCCU, which is an accrediting body in the Northwest, is very important, because you'll see later on, unknown to us when they came and were reviewing us for our accreditation regionally, they ended up giving us a Beacon Award, the highest award on support, because our students aren't traditional students. We don't want you to be necessarily a 4.0, mommy and daddy, or PhDs. We want people from the community that understand their rural community and will stay in their rural community. When I moved into this area, I was exposed to the local people. I've been here 25 years, a stranger danger. Oh, you're city folk and you don't understand us. To be honest, they were right. I did not. I did not know the pain of having to drive an hour plus to a grocery store, an hour and a half to a mall if we were lucky. And this is all pre-Amazon, remember? So now it's a little easier. But when I became the chief nurse of this local hospital, my patients were not strangers to me like they were in my academic medical centers. These were my kids' soccer coaches. This was my mailman. This was my coworkers' parents. This was my neighbor. So I always felt I was a good nurse, in all honesty, but I felt I had to become a great nurse, because these were really even people I cared even more for. So I appreciate rural. Casey and I have had numerous conversations. You want to call rural be a passion of mine? It is true. And I'll end that preachiness that why, if you live in a rural area, should you receive a lower level of health care? Just because I choose to live in some rural area anywhere in the country, but especially in Utah. I deserve access to healthcare and quality healthcare, but we can't do it plugging travelers in or working short-staffed or overtime. And I want to help you guys grow your own with a quality school. All right. So you can see here, we have all the way from PNs to MSNs, psychiatric mental health nurse practitioners, family nurse practitioners. We have no wait lists, right? And you test into us. We start 3 times a year, and we do online the didactic. For the BSN, we send you kind of a nurse in a box so you can practice your skill set and demonstrate on video to your faculty. And then finally, you do on-site clinical work. Casey and I had a wonderful conversation about a misconception that we're fully online. I don't know about anybody on this call or on this recording, but if a nurse taking care of myself or my loved ones have only been taught online, no thank you. I want people who know how to take care of people. Our average age of our learner, we call our students learner, 32 years. They have life skills. They may be single moms. They may come from communities even where English is not their primary language. And yet anybody in nursing knows they could be absolutely your next best nurse in the world. We believe in building pipelines, and we can work with you. Even funding, we can help you with funding. We have a support service called CLASP that we can introduce you to so that education becomes accessible. That was preachy. I'm sorry. You can see that sometimes passion comes across as very strong. Go ahead, Casey. There. So here's an opportunity, Kyle, I think that you'd like to speak about.
Yeah, and then just because I'm familiar with, across the country, the federal government released the Rural Health Transformation Program dollars, right? Most every state will have access to about $1 billion over 5 years. And so I'm working with a lot of the different folks in Utah, especially at the Department of Human Services, right, on, the parts of that funding that we can help with education. And there's $195.7 million awarded for this first go around. And the RHAU portion, if you're familiar with it, is the workforce and the education part, right? So we want to work with anybody that we can to, like we said before, help with the nursing education, help with access, and try to attack that 3,000 open positions in nursing in a way in the rural communities by helping with funding to help educate them. So RHAU is the #1 opportunity for us to help, and then SHIFT with the infrastructure, right, is a little lesser of an opportunity, but we're looking at both opportunities to try to help rural Utah with nursing. So exciting opportunity.
All right. So this is the Nightingale. Remember I said the Beacon Award, the White Glover Learner Support. This is, how is it a benefit to you? The students, what we'd love are facilities throughout Utah to identify even that CNA, that food service person, that EMT, that you just, man, they're there when you need them. Storms, the weekends, the night shifts, they're dedicated, but maybe they don't have the avenue to be upskilled. So we want to support them, and they may need additional help. Maybe they don't have optimal math or English skills. Even if they test in, if they don't get a qualifying grade, we offer a course to help them get up to par, to be equal with their peers and ongoing. That was that whole weekend Beacon Award. The no waiting list. I myself am in my DMP program. I looked for a college that met my timeline and not in 2 years or 1 year, or I was going to have to jump through hoops. I know how nurses think when they want it. If you don't allow them into the system because their grades aren't high enough or they don't have their funding, they're going to go and find something else to do. right? They might become a PT assistant or whatever. We don't want to lose them because you need nurses in your community. The no prerequisites, sometimes it's hard for people to be a single mom, go to school for prerequisites, then apply. I want to be crystal clear to anybody who is involved with higher ed. We are not ever here to compete with your state education systems. We are here to complement them or supplement them. It is very hard for people to travel to brick and mortar schools after maybe having worked a 12-hour shift. Maybe they have a manager. We facilitate people being able to maintain work and still go to school at the same time. Blended learning. We use technology in our BSN programs using VR simulation because I've done it in my own learning career. Instead of having a sim lab, which is good, I can tell you in a sim lab, I was the wall hanger. Like, right? I was like, yeah, go ahead, Stacey. You go up in the front and you practice. I'll watch you. Did I learn anything? I probably didn't. But when I used VR and I had to master it, I was competing against myself. I never even knew that I'm not a gamer. I'm too old. But man, I was very competitive when I could use technology to help me learn. And that's where we're going. Physicians have used VR technology for more than a decade. And if you want to get a chip on my shoulder, don't you let a physician get a better opportunity than a nurse, because there are 1 physician to 5 nurses. So everyone's like, oh, we really need physicians. We do, but you need even more nurses. So let's invest in them. Concept-based learning. This means that we don't teach, this is cardiac, this is ortho, because your patients don't come in like that. They're complex. Maybe they're having a heart attack because they got in a car accident that broke their leg. So we do concept-based, which means you look at the holistic patient. We use technology. We have non-traditional learner populations from all over the country. I've been up to the Arctic Circle in Alaska to meet some of our learners up there that are doing it in remote villages. Do I think it can be done in Utah at a big? Absolutely. And we want to partner. We want to partner with you. We're not selling. Our school is growing. We're going to have 20,000 nurses by 2028. We don't need to sell our program. What we want is partner with healthcare facilities to solve this shortage. All right. I'm preaching.
Great.
Gosh, I got to
Not at
stop.
all.
Go ahead. Next slide, Casey.
So you may have read through some of the price of some of our programs on the slide before, but we currently have an opportunity to save 30% in the state of Utah for anyone who would like to be enrolled in our BSN program. And Casey has graciously agreed to put that in his newsletter for this month. So anybody that's a part of the Rural Health Association will get that information and can look into that. So I guess in summary, right, we just want everybody on the call today to know who Nightingale is. There's just been some recent misunderstandings, I think, of what we do and who we are, right? And some of it may have come from that other Nightingale nursing school that was selling diplomas instead of making you earn them back east, right? So we wanted to kind of clarify that and let everybody know what we're really about, what we're really here to do, and that our true goal is to help people get access to nursing while they're providing for their families, or they have life happens, right? And you have to go to school. So we want them to be able to take advantage of a plan and a program that works with them like that. So the technology has helped tremendously. And we look forward to, I guess we just talked about most of these things, right, already, but
Yeah.
Sorry, go ahead.
Sorry, Kyle. I want to, because I know we're at time, I want to stress one thing. So we're produced, and this sounds terribly business. Nurses don't like business. The program doesn't offer a part-time option. You can, if you can take some breaks in your semester. So is it Bailey that asked that? We can put you in touch with an admissions officer. Just give us your email and we'll put you direct contact so you can talk that through. I want to say that this sounds terrible. I know we're producing a product, which is a nurse, right? Anything in business asks their customers, hey, is this product that we're creating fitting your need? Education has never, ever, ever done that. 49 years as a nurse, there was never a nursing school that said, hey, Bonnie, we just created a LPN, a BSN, a MSN for you. How are they? Is there some feedback? We just completed a survey with 600 partners to ask for that exact feedback. If anybody wants to give us feedback on what they'd like to see from nurses, we are very open to it. We will then assimilate all that data, create competency statements, and currently kind of recreate or adapt our curriculum. We have to meet our accreditors, but what else needs to be added? Some sort of, we don't call them soft skills, we call them power skills for those conflicts that happen in healthcare. Anyway, so feel free to reach out to us. Like I said, we care. Okay, Bailey, we connect with you. Carolyn Levecki, we'll reach out. Kyle, you've got that in the chat.
Yep.
Right.
And feel free at any time to reach out to either of us. Our information will be included in the recording of this. And so if down the road you need more information or help, absolutely reach out. We would love to.
Oh, perfect. Thank you, Bailey. This is wonderful. And any other questions or concerns or thank you, Casey, for being our wonderful driver there in St. George.
And I do want to also point out, if anybody's planning on coming to our RHAU Tech Summit, which is happening next week, Kyle will be there and they will have some of their VR technology there available to come check out during the breaks. So it's a great chance to see kind of some of the technology that Nightingale uses in their program.
Yeah, you'll be able to you'll actually see the simulations and be right there in the patient room. And yeah, it's a neat system that they use.
And we have a rural health learning module because when you work rural health, it is very different. The first hospital I went to, they said, okay, so we're a critical access hospital. And I go, a what? Never mind. They were frontier clinics. I was like, oh my gosh, I had been a nurse for about 25 years at that point. I never even knew they existed until I moved to this region. And I think that's the value add. And the majority of our national population live rural. They don't all live in cities. So we've got to help them. Yeah. All right. We appreciate this great opportunity, and we're looking forward to hear what Stacey is going to teach us here. And but thank you all for your time.
Do you have any other questions from the group? We do have a few more minutes for Q&A if anybody else has any other questions.
I'm going to give our PowerPoint an A or an F, that either we didn't hit the mark or we really did. And that's
Confused everybody more.
Assuming from that. Yeah.
Awesome.
Thank you.
Well, thank you, Kyle and Bonnie. Our team at RHAU is very excited about the work that Nightingale's doing here in Utah especially, and appreciate your commitment to thinking outside the box and advancing innovative approaches to training our future nursing workforce, and especially for rural communities who are most in need. We encourage everybody on the call and everybody listening to the recording to explore their resources and programs for your teams. And connect with Kyle and Bonnie and the Nightingale team if you have any questions. I've had a chance to visit their offices in Salt Lake, and they've participated quite a bit with RHAU, and always been impressed with the quality of their materials and programs, and excited to see how that can fit into the larger landscape of solving our nursing workforce needs going forward. So
thanks, Casey.
Thanks, Stacey. Yeah, appreciate that.
Awesome. Well, we'll shift gears now and welcome Stacey Peterson. Stacey serves as the Operations Program Manager for the Rural Connections to Research, or RCR program, which is at the Utah Clinical and Translational Science Institute within the University of Utah. Her work focuses on logistical clinical research, specifically on expanding access to clinical trials in rural communities. With a background in healthcare research and risk management, Stacey specializes in process optimization and community engagement. And her professional focus is on rural health and developing research infrastructure for remote communities. Stacey, the time's yours. We'll go until 12:50 or until you're done.
Thank you so much. Next slide. Good afternoon, everyone. I'm so grateful to be here. Thank you so much for having me. Thank you, Casey, for the introduction. And I'm so thrilled to share a topic that I know is near and dear to all of our hearts, bridging the healthcare gap for our rural communities. I know we all wear many hats, and sometimes you wear many hats before 9 a.m. And so my goal today is to show you a simple, straightforward partnership that benefits your patients, your clinics, your hospitals, your staff, and the future of medicine without adding a mountain of paperwork to your desk. I'd like to start by showing you a short video regarding the RCR, and we'll go from there. Thanks, Casey.
And I'm going to take over because we have to switch how the sharing's happening in order to make it work right. All right.
Utahns have a strong sense of identity and place. We love the smell of freshly cut hay, the bluebird sky on a warm summer day, the first snowfall of the year, and the occasional rain hitting red rocks and arches. Rural connections to research bridges the communities, ensuring everyone can access vital health research and resources.
Rural populations are people who live more than 50 miles from the urban center. People who live in rural areas participate in clinical research at a rate less than a quarter of their urban counterparts. And we ask them why. They say it's because of the barrier of travel.
The RCR initiative, supported by the University of Utah Clinical and Translational Science Institute, transforms research participation by establishing blood draw sites across a 5-state region, reducing travel burdens and simplifying study participation. With local processing and central shipping, we maximize rural involvement and enhance our research. At the heart of the RCR is a strong network of partnerships with community health entities, ensuring translational research is accessible to all.
So as a researcher who runs clinical trials, we work really hard to get our rural patients to enroll, but sometimes they can't come because of simple things like they don't have a blood draw that's available to them locally. So if we could solve that problem, we might get more research patients in our rural areas.
Researchers, join the RCR. Help us to improve health outcomes for everyone by increasing research participation for people from rural communities as well as urban settings.
Join the RCR.
Join the RCR.
Join the RCR.
Join the RCR. Thank you, Casey. Flip back to the slides.
All right.
The secret to healthy, mature skin is Miracle Ball.
Okay.
Perfect. Thank
We're good to go.
Yeah, great. So 46 million Americans live in rural or frontier counties, and in rural Utah, the roads are long, and the access to specialized clinical trials is incredibly limited. From a scientific standpoint, if rural patients are not participating in clinical trials, we honestly don't know if the results truly apply in the real world. And when we first began this initiative, we asked the question, how do we fix this? And the answer was pretty simple, and it still exists today. We stop asking the patient to drive long distances, and we bring the research to them. This is how the RCR was created, and I like to think of the RCR as a delivery service for clinical trials, and our goal is to enable research study visits to be performed locally and virtually. And we do this through a hub and spoke model. Places like the University of Utah, Intermountain Health, Huntsman Cancer Institute act as the hub, and incredible community clinics and hospitals in rural places act as the spokes. And early on, we had one promise, and that is we are your partner. You are not our partner, we are your partner. And we still feel very strongly about that today. Next slide, please. To make this happen, we created a phlebotomy collective. Right now, we are partnering with amazing hospitals and clinics across 6 Mountain West states. The heart of the RCR is this collective. Our partners simply do what you already do best, right? Every single day, exceptional clinical care. And our team at the RCR handles all the research specific logistics in the background. It's important to note that our Intermountain Health partner has opened up all their Intermountain Health facilities to the RCR. And so that means any Intermountain Health facility, if you are needing a blood draw, you can go there. I had a call last week from a partner way in this really remote place in Wyoming. And Intermountain Health had a small OBGYN clinic, but they were able to go there and have their blood drawn. So that's just a wonderful partner that we have. And all our partners we absolutely love. Next slide, please. Let's talk about like workflow and kind of the logistics of the RCR. So the RCR is a fee-for-service model. When our investigators at the Huntsman Cancer Institute or Intermountain Health or the American Cancer Society or the University of Utah have a patient or participant that is in their clinical trials that need their blood drawn and they live in rural Utah, they can contact the RCR team and request that they have their blood drawn locally instead of traveling to any of our hub places like the University of Utah. We then, the RCR team, gather all the details regarding the blood draw from the study teams, what type of tests need to be drawn, would they like the facility to process the blood locally, or does that blood need to be sent out like to a lab, say at Johns Hopkins? And is the patient arriving with their own set of tubes? Sometimes that's happened. We gather all the information, then we contact our RCR site and we share this information. We just let them know that there will be a patient coming. We do all the scheduling. We just contact our RCR site and kind of collaborate with them, ask them when a good time is for them to have the patient come. The RCR handles all of the billing. The invoices are sent directly to our office. We collect the money then from the study team and then pay our RCR partner. If the site is an RCR partner, the study team is charged $200 per draw. It's charged $250 if it's a same-day request. That does not include charges for processing. If our site processes the blood, those charges are added on to the charge and billed to the study team. The second key point to understand is, because it's a little confusing for some of our partners, our RCR partners are not considered part of research. So they are not liable for any research. They simply are a facility and a partner, and they're not listed on the IRB. It's simply a fee for service. As you can imagine, our sites offer all different things. We have a small site, small, in Island Park, Idaho, and they are unable to process the blood. They can draw the blood, they cannot process. So we kind of handle all those arrangements with our different partners, letting our study teams know what our partners can do and cannot do. We have larger sites, as you can imagine, in St. George, Utah. It's a little bit larger. They can process blood. They can do other things a little bit
Stacey, it
At
looks like.
NESO, we kind of keep things moving. We've have been working on this week with our IRB, expanding our services into allowing our partners to provide CT scans, chest x-rays. And so they don't have to travel to the hub places and have these things performed. And we met with the IRB on Monday, and they've given us the go. So that's an exciting move. We're really pushing that needle for our rural participants. Next slide, please. Why partner with the RCR? We're always happy to partner with anyone interested. If you're a small clinic, if you're a large hospital in Utah, our goal is to keep the patients and our participants local. And I think it's important to note that if you're a small clinic and worried about like all of a sudden having 20 blood draws, you know, on Monday, that's not going to happen, right? Some of our smaller facilities, partners, they might have one blood draw every 2 months or every 3 months. So if you're worried because you're a smaller clinic, reach out. Our goal really is to keep our patients and our participants that are in clinical trials local and at home, and just so they can go to their local clinic, their local hospital, and have their blood drawn. And also, it's interesting and it's been really fun to have our community partners being able to offer cutting edge trials to their participants and treatments that otherwise they wouldn't have access to, and building that infrastructure. And it means that your nurses, your coordinators, they don't have to be a part of complex city training courses to be a part of the research. That's all handled, you know, on our end. You are providing the standard just services that you provide every day. And the scheduling happens entirely on our backs. So it's been really fun. Next slide, please. This is my favorite slide. I get a little choked up because Lee Jones was our very first RCR participant, and I'll share a story about Lee. Lee is currently in a study for breast cancer at the Huntsman Cancer Institute. It's a state-of-the-art trial where she's receiving current medication that is extending her life, which is amazing. Lee lives in Rock Springs, Wyoming, and she would make a drive about 5 hours weekly to have her blood drawn. And Lee didn't mind doing this with her husband. They would enjoy the day. She'd have to take the day off work and they would make the drive. Well, unfortunately, Lee lost her husband, and that changed things for Lee. She was having to make the drive herself, and in the winter, not very fun. And so Lee was faced with the decision of having to withdraw from the clinical trial and not being able to continue the medication that she's on. And the study team at the Huntsman heard about the RCR, contacted us. We in turn contacted our partner at the Memorial Hospital of Sweetwater in Rock Springs. That's actually 5 minutes away from where Lee lives. And I was able to make the drive to Rock Springs and meet with Lee. And it was very exciting. She came at 7 a.m. She had her blood drawn. She didn't have to take the day off work. She didn't have to drive a long distance. She was able to have her blood drawn. The blood was processed in Rock Springs. The doctor was able to have her results by the end of the day, and she had a virtual visit that afternoon. And it was just really, it was so exciting because it's exactly why we started the RCR, and to see it in, you know, really come to fruition and really benefit the one person meant so much to us. And I think that's what I like to emphasize. You know, we are really interested in the one person that lives in Kanab, the one person that lives, you know, in the rural part of Utah. We're here to help that one person have access to some state-of-the-art clinical trials. Lee actually last week had a CT scan also at Rock Springs. Memorial Sweetwater. So that was exciting. She's kind of our trailblazer. She's kind of our person that is kind of pushing the boundaries, which we love. And it's just wonderful. Now she doesn't have to travel to Huntsman. She gets her blood drawn weekly right there, 5 minutes away from her home. And that has just pleased us. It's just so fun to share her story with us. Next slide. So our growing partner network, we currently have over 22 active community clinics and regional hospital partners across the 6 Mountain West states. We have a wide range of active trials. I think this is one of the exciting parts is we have a lot of clinical trials and they range from all different kinds of care. We have a better pain care trial that's a telehealth for chronic pain. And we have patients that have their blood drawn every 3 months. We have several cancer trials that the RCR is a part of. We have a genetic testing trial. We have a Gulf War disease trial that some of our veterans are a part of. It's just really wonderful to see all the different trials and how the RCR is making it easier for our rural participants to be a part of. And what's really fun is to be able to call our partners and say, you know, we have this trial. If you run across any patients that are interested, let us know. We'll connect them. And that's been really fun. We've actually, our small little partner in Island Park, actually the one doctor there really wanted to be a part of research. And so we actually connected him with one of our researchers here at the University of Utah, and he's become a part of that trial and on the IRB. So it's been really fun, full circle, and to kind of make more access to clinical trials. Next slide, please. We currently have 13 different departments at the University of Utah and Huntsman Cancer Institute that are utilizing the RCR. It's kind of fun to see all the different departments. Of course, several oncology departments, but we also have pulmonary and nephrology, neurology, population health science. It's just really fun to see and become more aware of all the different departments that can draw blood locally now for a trial, and more people can be a part of these trials. And I was actually contacted last week by a participant in Price, Utah. So we were contacted by the participant itself, not the trial itself. And he was a darling man, and he said, I'm a part of this trial, but I want to have my blood drawn locally, and I heard about your program. Tell me about it. So he was the one who kind of generated the spark, and we contacted his trial that was within the university, and now he's able to have his blood drawn in Price. So it's connecting, you know, the connection is happening not only from the clinical trials part, but from the participants side of things, which is really exciting. So next slide. So if you're interested and would like more information, scan the QR code that just has my email, and I'm sure Casey will share this, my email with those of you interested. It's incredibly easy to become a partner with us. We simply schedule a 15-minute meeting, and we kind of go from there. As you can imagine, our contracting is a little bit different depending on our partners. Intermountain Health, our contract with them was significant. Our contract with Ashley Memorial, really one page, really easy, simple. So we meet with you and we make it work for you. And also too, I want you to think of us as your partner. And if there's things that you need or need access to, I had one of our partners contact me last week and just say, hey, Susie, do you have any webinars or classes that can help our staff with AI? And we actually do. And I was able to send them, you know, free webinars that they could join. And so we really just want to be your partner, because at the end of the day, it's about our communities, it's about our neighbors, and it's about making sure that a patient's zip code doesn't determine the opportunity to life-saving, you know, science and clinical trials. So thank you so much for your time today, and thank you for everything you do, and reach out if we can be of any assistance to you. And if there's any questions, I'm happy to answer them.
Stacey, there was a question from Bailey, but I think you answered it about being in contact with Huntsman Cancer.
Oh, yeah. Yeah, they are definitely one of our partners, and we work with them very closely. Yeah.
And I'll just add on a personal note, access to clinical trials is potentially life-saving and life-altering, and it's very difficult to do from a rural community. I have a 4-year-old son that's alive because of clinical trials, and in order to access those, it required us to relocate to California for about 9 months.
Yeah.
And so if there's ways to expand this access to folks in rural communities who wouldn't have the means to pursue them outside of that, it is worth every effort to do so. And I think sometimes there's misnomers that a clinical trial's not that impactful, and it's not true. Sometimes clinical trials are what saves somebody's life. It's access to a treatment they wouldn't otherwise get access to.
That's so true. Thank you for that, Casey. I so appreciate it. One of our physicians, she was actually in the video. She's a world-renowned neurologist, and it breaks her heart when she has somebody come in who's had a stroke from rural Utah, and she wants to enroll them in some state-of-the-art care in the clinical trial. And they unfortunately have to say no because the travel is so much. It's just unfeasible, and it really just breaks her heart. She said she leaves that room and she just like, I want to get in my car and travel to them weekly because it can really help them. And so we're being trailblazers, and we're saying no longer is no a feasible answer. We're going to make it happen. So yeah.
Thank you, Stacey, for everything that your team's doing.
Absolutely.
Do we have any other questions for Stacey?
I don't have a question, Stacey, but you have just reinforced why should someone who lives rural receive a lower level of health care than people. This just demonstrates it over and over again.
Over and over.
For the work, I certainly remember back in the day when I'm on the East Coast, but you traveled to Dana-Farber, and here you are going through dramatic chemotherapy. You couldn't feel any worse in life. And for sometimes it was twice a week labs back then that you were then, let's get in a bumpy with potholes in the spring and curvy roads. It was like just horrible. I will certainly keep an eye on you guys.
Yeah, thank you.
You are doing what we'd like to do.
Yeah. Interesting. I presented at a large conference last month in Florida, and the room was full, and we laid out the RCR program, but I started by just asking the simple question, how many here would travel 5 hours round trip once a week to be in a clinical trial and to be part of, state-of-the-art care that you need? And not one person raised their hand. And it just is exactly why we have to keep doing this, right? Because it's true. It's such a burden to travel that far. And we're going to make this happen. We're doing it. It's so important. So.
Excellent. Well, thank you, Stacey. And
absolutely.
I'll just say thank you to all three of you that spoke today. This is a great way to start off our 2026 run. These are crucial programs that really are doing amazing things to help improve access. And I know that is one of the core pillars of RHAU and a lot of our board is that healthcare access shouldn't be determined by zip code. That's kind of the catchphrase for it. But rural folks deserve access to just as strong of care as the folks in urban can access. And these are a couple programs that are certainly helping bridge those gaps and improve care in rural. So we appreciate everything that you and your teams are doing. And just thank you for speaking in today's session and sharing more about your resources. And we also want to thank those who joined us today. Your support is essential to the long-term success of our webinar series as well. And thank you to everybody that takes the time to view this recording. We do want to close out today just with a couple notes. Our next session will take place on May 7th, which is a Thursday at 12 p.m. Currently, we have the HEAL program at the Utah Department of Health and Human Services who's scheduled to speak. That's the Healthy Environment Active Living Group. We do have a second slot open. So there, we do have on our webpage, which you can follow the link there on the screen. We have a place to apply to present if anybody's got similar programs or resources that they'd like to present. We encourage you to fill out the application, let us know so we can get you scheduled. And we have spots for all the rest of the year open. So even if it's not for that May series, if you're interested in presenting in the future, please let us know. And then again, you can see all of the recordings from not only today's sessions and the future sessions for 2026, but also all of the 2025 recordings are also still available on our website. And then if you're interested in attending again with us in May, the QR code there will help you register for that, or you can find the registration on our website. It's on the homepage as well as on the RHAU.webinar.series page as well. Thanks everybody for attending, and we'll close out this session, and we'll post the slides and send out the recording to everybody registered. And thank you for joining us today.
Oh, thank you, Casey, for being so supportive.
Bonnie and Casey.
Bye, Stacey.
Have a great day.
Shannon, I'll look forward to an email. All right, and
Thanks everybody.
I will follow
Bye.
daily. All right, thank you.